Hi, Kylie. How are you?
I'm good, Robbie. How are you?
I'm doing great. Thanks for meeting with me today. I really appreciate it.
Of course.
Were you able to get on the Zoom call pretty easily?
Yes, kind of. More or
Perfect. I know
less.
sometimes it could be a little challenging. It is kind of nice though that we're able to do this now with COVID happening and stuff like that. Just kind of getting to know you a little bit better, take a look into your practice and seeing how we can help you with that. So I do feel like it's a little bit easier, just kind of meeting here and touching base first.
Oh, yes. And technology, it's been quite a trip trying to navigate all
I'm
that through this
sure.
COVID time.
I'm sure you guys have had a lot of challenges as well within the dental practice, implementing new procedures and policies. Have you guys had any problems with that as well?
Oh, yeah. Especially when it comes to our insurance claims and sending those out and getting those back. Our practice just recently split apart. So navigating that amongst all the other things. But definitely it's been a time where social media has really impacted us and helped us along through this time as well. So,
And that's perfect. Yeah, I did hear that you guys split, but it seems like you guys are growing a lot. That's really great.
oh yeah, we're we're having a trying to navigate like that, like you said, trying to navigate splitting and working out the kinks and the bumps with that. But
For sure.
it's
For sure.
been a headache, but we're kind of getting to the point where we're getting our ducks in a row. It's starting to become easier and for us to navigate.
Perfect. That's great to hear. Well, any way that I can help you out along that process, just let me know. We do a lot of training as well. So, how many hygienists and assistants would you say that you have?
We have we've had quite a few hygienists quit, and we've had a lot of hygienists on maternity leave right now, actually. So we've been navigating through that. So some have been on maternity leave, and then others are just coming back from maternity leave. So altogether, we have six hygienists, but we only have five in the practice right now.
It's still a lot.
Yeah.
And how many doctors do you have total?
We have three doctors total.
Okay, great. Are they new out of school or are they been practicing for a little while?
Both. We have some very experienced doctors, and then we have newer doctors that I'd say maybe like 1 to 5 years out of dental school in that timeline there, but they all have their own kind of area of specialty that they like to stick with, which really helps our practice out a lot because we're more able to accommodate all sorts of patients for whatever their needs may be, whether it be just general emergency visits or something more thorough like oral surgery, cosmetic cases, even a little bit of periodontics, Invisalign. Our office is able to compensate
Wow.
for all patients like that.
Yeah, it sounds like you guys do everything then there, huh?
We try.
Well, that's great. Well, I'm going to go over just a little bit of information here and go over a couple different questions with you. Is that okay?
Yes, go ahead.
Perfect. Well, my first question, Kylie, I was just kind of looking through your company's website and seeing what you guys specialize in. What would you say that is your most favorite type of dentistry thing to work with? Would
My
you
most personally, my most favorite type of dentistry are the smile transformation cases, the Invisalign, the veneers, the cases where you're able to just see and impact the full effect. Those patients are the most grateful to you for helping them out and your service that you've done for them. A lot of patients in like general dentistry, most of it's just like, oh, you need a crown, and it's just like,
yeah,
oh, okay, I'll get a crown. But they also so happen to be the big money cases like that where people, they have to spend quite a chunk, but they are the most rewarding cases to do and be a part of.
yeah, I could totally understand that. I'm sure that that is kind of an emotional transition as well for them. Do you feel like that's kind of where you gain their trust is through capitalizing on their emotions, would you say?
Oh yes, a big part of it is trust. That's a big part of a patient going through with any kind of treatment, is money and the trust they have for that dentist. So it can be these patients do become like a family to you in that sense where you end up spending a lot of time with them obviously, and
Um,
you learn their underlying emotional issues of why they want to do something like this and why it's a big deal to them, why they want to get started. So it definitely does take quite a bit of trust on their part.
Yeah, definitely. So when I was looking at your website, it looks like you guys are very tech savvy there. Can you tell me a little bit about like your new patient process? How does that usually work for you? I know that you guys probably have like an intraoral scanner or a camera and you know, all the digital aspects of the office. Can you tell me what your new patient flow looks like?
Well, we do see a lot of patients, and it is very important that our technology does work smoothly without flaw. When we have a day where technology is not working correctly, it majorly affects our office, and it gets me flustered, it gets my assistants flustered, the hygienists. We do take a lot of documentation is all nothing is paper anymore. It is all on the computer. It's all electronic, and documents are processed and transferred electronically. So making sure that our cameras, our X-ray units, our 3D scanners, everything like that is up to date and working smoothly is very important for the day-to-day
Yeah.
flow of my
So it sounds
office.
like you're looking for products that are really reliable and that you can count on a daily basis then, correct?
Yes, probably nothing cheap that you could get on Amazon that's not going to hold up that long.
For sure. Well, I want to just thank you for letting me have the opportunity to speak with you today. I would love to kind of come into the office and get to know your staff a little bit better. I'm not sure if that would be something that you'd be interested in.
Come on down. We love to have you and visit you and have you tell us and see anything, any kind of new method or that other offices are using that is very helpful to them and their day-to-day business and that you think could be helpful to us as well.
Yeah, definitely. I've obviously been into a lot of offices. I've seen a lot of things that do work and don't work. So I do feel like I can kind of provide that experience for you guys and kind of walk you through what does work and what doesn't work and really coach and train your hygienists and your assistants to really get them where they need to be before you even come into the room.
Yeah.
All right. Well, I will see you soon. Then thank you again for meeting me.
Of course, anytime. Thank you, Robbie.
Bye.
Bye.